We've all seen the signs advertising ER wait times at area hospitals. But what you won't see advertised,
I don't think it's right. It seems really unethical.
a situation 3 different women profiled by the CBS 6 Problem Solvers say they experienced.
And I'm just a person stuck in the middle, trying to be treated fairly.
Each say they received a surprise bill in the mail after giving birth or receiving emergency care at HCA's Henrico Doctors Hospital.
I didn't pick to see this doctor. Like, I went where you told me I had to go.
Lynette, Liz, and Lindsay all say the hospital is in network with their insurance, but at some point they were all treated unknowingly by out-of-network doctors.
When you're giving birth, the last thing you're thinking about is, wait, before you do anything, can I have your number to check and see if you're within network?
Their stories sound a lot like what experts call balance billing, and it happens a lot.
How common is this issue in Virginia?
Well, I think it's quite common everywhere around the country. I mean, this is not just a Virginia issue, this is a national issue.
Doctors, hospitals, and the insurance companies all say they want to fix the problem, but none of the stakeholders can agree on a solution.
This is a business model.
Doug Gray represents insurers like Anthem and Cigna. He blames hospitals and doctors for the bills.
Who hasn't seen a billboard with a short wait time of 8 minutes to go into the ER? And then they expose you to someone they've hired from a national staffing company that they have not required be in network. That's setting you up to be balance billed. And it's wrong.
But Julian Walker, who represents Virginia hospitals, says the fault lies with insurers who he claims are trying to drive up profits.
So why is it that the hospitals can't just say we require every physician working in our hospital to be in network?
That could lead to an impact on patient access to care.
Walker says insurers don't include enough doctors in network, so the hospitals might not have enough doctors to staff a 24/7 operation if they couldn't use out-of-network doctors working for independent physician groups or third-party staffing companies.
Many hospitals say to the people that they are contracting with to provide care in their facilities, we expect you to be in network with everyone that we're in network with.
I mean, you said we expect you to be in network, but that's not a mandate. If you mandated that these providers be in network.
But a hospital or any other healthcare provider can't mandate to the insurance company how broad or narrow the network is. The hospital isn't deciding this is the scope of the network. The insurance company is deciding the scope of the networks.
So why are these doctors out of network in the first place? Dr. Richard Such, the president of the Medical Society of Virginia, blames insurers, suggesting they often don't want to pay a fair rate to the doctors and sometimes limit the number of doctors in network.
It would be like going into a restaurant and saying, I'm going to give you $15 and I want a nice steak dinner, and you have to take it. And that's not right.
But Gray claims physicians are making plenty.
Are they paid poorly? No, they're not paid poorly.
He points to a publication that shows ER docs in Virginia are the 6th highest paid in the nation, earning an average of $426,000 a year.
From their perspective, they're suggesting that doctors are making enough money as it is right now. So why do they feel like they need to go out of network to get fair compensation?
I think that's the only negotiating tool that physicians have with insurance companies, is to go out of network if they aren't in agreement with the rates that the insurance companies are proposing. Physicians want to provide quality care to patients, and we want to be able to do that. If the reimbursements go too low, physicians are going to have to decide either that they can't care for the patient or they're going to have to cut some corners and reduce quality, and we certainly don't want that.
Some states have already enacted solutions to balance billing, but state solutions don't apply to most people, so a federal solution is needed. President Trump has said Congress needs to act to stop patients from getting surprise medical bills. So we traveled to Washington and sat down with Senator Mark Warner, who told us his family received a massive surprise bill.
If you get these surprise bills, you should try to fight them, particularly if you have insurance, particularly if you're at a hospital or doctor or service that you think is part of your network. I think you need to basically say to the insurance company, no, I pay for this insurance.
Next Tuesday at 11, we talked to Senator Warner about what solution he supports and when he expects the problem to be solved. Working for you, I'm Melissa Hippolyte for CBS 6.